Good morning, everyone. I hope everybody's doing fine. Happy Friday. It's a beautiful day, beautiful weekend we're going to have. So take advantage of. And today I would like to go to some basic uh, hips exercising or stretching to relieve some of the tightness. It can do by many reasons, probably psoas or tightness on the groin, also sitting for a long time or a lot of physical activities or tiny. It can come also from lower back and believe it or not, TMJ. So I will show you some basic reflexology points, then we can work on that as well. My name is Iris Lama and I am a massage therapist for the Wellness U program here at the Hospital of Salaga. Welcome. Have a nice deep breath in and out, in and out. One more time, in and out. Very good. Let's start with the right hips or the right leg. You can hold into something if you need to. So first of all, bring the knee up and then let's do a small circles. We can do about 8 to 10. And with this movement, we start loosening some of the muscle around the hip joint. And repeat in the other side. I'm going to turn it to my side and let's reverse that. And repeat that on the opposite leg. So I'm going reverse the circle. So we start with about 8 to 10 repetition on each leg. The second stretch that we can do is kind of like swinging the leg side to side, kind of like a golf swing. So make sure that the spine is straight and then you are on to a neutral position so you are not overextending the lower back. Keep your core nice and tight, hold to something and go from side to side. So internally to external motion. I'm gonna show you from the front. So we did 10 repetitions on each. The second one can be same like I did with hip circle, but now we're gonna just do a small circle with each foot. And reverse. From this angle. And reverse. Very good. Another standing is kind of like a back kick, but it's going to be more soft and a slow motion. It's just very natural. Just swing the leg back and forth. And repeat the same thing the other side. So that can be a nice warm up. You can do this before you start your day and also uh, before you go to bed or anytime you can fit. Now, let's target the groin. Stretches here for the groin of the hip flexors. So lift one arm and then lean forward. Hold that stretch for about 30 seconds. And slowly come back to center. Inhale and lean forward a little bit more until you can feel the nice stretch on the groin area. When you're ready, switch leg. Inhale, exhale, lean forward. Release, come back to center. And do it one more time. Inhale, exhale, bring forward. I can feel a nice stretch here all the way on my hip flexors and also my quad muscle. When you're ready, you can do this sitting down on a chair or on the floor. So I'm going to cross my leg and bring the knee toward your chest. As you lean a little bit back, you can feel a nice stretch here on the piriformis muscle. Breathe, exhale, and lean back. Also push your knee towards your chest. Hold that for about 20-30 seconds. And when you're ready, repeat the same on the other side. Inhale, exhale, bring the knee towards your chest. Hold. And release. Another stretch is kind of like a butterfly. So have feet together and make sure that your spine is straight. Take a deep breath and out. So bring the heels toward you. Hold that. You can feel a stretch all in the groin area. Inhale, exhale, lean forward, very gentle. Hold. And come back. I want to leave some time to target also some of the points that we're going to use today for reflexology. I'm using some massage oil and also today lemongrass because I have a long day, so it can give you more energy. It's depending of what you need it to. Sometimes you need it for relaxing, sometimes to feel invigorated, and more energetic. So lemongrass is one of my favorite too, or peppermint. So let's start with that. I'm gonna show you first here on my reflexology chart that I have on the foot, the points that we will um, target today. So I would like to let me give a little bit here. Okay. I would like to show you. So if you look at your foot, we have the malleolus. So around the malleolus, we have the sciatic nerve. So we're going to have some soft tissue here, the sciatic nerve. Sometimes when we have discomfort on the sciatic nerve, that's our longest nerve, as we know, coming all the way down from the back around the last rib all the way down to your feet. So I like to work on that. So around the malleolus is some points for the sciatic nerve. Also on the base of the malleolus, you can see we have here the hip joint, hip joint. And then if we come down, straight down, we're going to work on the knee as well. So it's all together. We can have hip discomfort. It can be from coming from the knee, and it can be just psoas and hip flexors and lower back. So we will target the hip joint, also the knee, which is on the lateral side from the malleolus all the way down. We have the hip and the knee. So let's target that. And then if we work on the inside as well, on the medial side, coming down, we have the sacrum. So we will work on the sacrum as well, and the medial side of the foot on the arch, we have the lumbar, and we go all the way down, and just why not work also on the cervical. So we get all the spine, and we will finish with a knife massages on the TMJ. That, believe it or not, is all connected. And when we have sometime tightness on the TMJ, that can also give us some discomfort on the lower back and hips. So I like to just work on that as well. So address the knee, address the lower back, the cervical, and the TMJ muscles. I need to check here. Okay, we're good. Sorry about that. Use some oil of your preference, just to light. Is everybody can see? Okay, so using your four fingers, let's start on walking around medially and lateral on your malleoles. So with a small circle and reverse that. This can be very sore and sensitive for some people, so make sure that you go easy. So I'm going to now use some technique here with tongue walking. So tongue walking, it will be like a caterpillar motion. So going up and down onto the hip joint, which is below of the malleoli, and you can do that on the inside and also on the outside. If you find a spot that is tender, just apply some pressure down and keep it pressing down for about 60 seconds and then release and go that couple of times. So tongue walking and pressing down and release. If I turn into the outside, where is the malleolus here, we going up, and that correspond to the sciatic nerve. So again, I'm using my tongue walking technique. Motion. If now if we look at the malleolus coming down to the calcaneus, the heel, we're going to uh, work in this area, and that is for the knee reflex. So press down and release, or some tongue walking around that area. Target both sides, so internally and externally on the malleolus. Then on the arch, so I'll show you around here. From the heel coming up medially or to the center of your foot, you will work on the sacrum area, also in the lumbar. So let's go all the way up with tongue walking technique from the heel immediately all the way up to the toe. So press down and glide up. Press down. I find a sore spot, so I'm going to press down, hold, and release. Keep doing your tongue walking, working the lumbar, all the way on the spine reflex, cervical, until the top of the big toe. Do that again. So from the medial side, you can press both medial and lateral here. Let's do some single and tongue walking. Follow the arch and keep moving along all the way up to the top. Repeating everything that we are addressing. A summary is focus on the mid reflex. You can find the mid reflex on the lateral lower side of your malleolus or heel. So we target here the knee reflex. If we're going up on the malleolus, internally or externally, we do have the hip joint reflex above the malleolus all the way up that correspond to the sciatic nerve. Tongue walking, press and release some circle. Once you address that on the lateral side and medial side, we have the knee and we have the sacrum reflex. So working on that area and then tongue walking all the way up to the inside of the feet. So we address the lumbar, thoracic, and cervical. Once you repeat that 2 or 3 times in one foot, don't forget to address the other one. So let's work a little bit on the jaw. So on the jaw, on the big toe, on the top of the big toe, we have the lower jaw and the upper jaw. So right there is the toenail on the top. We can find the reflex points for the jaw. So tongue walking from medial to lateral, lateral to medial. Apply some pressure that is comfortable. Small circles to the right and reverse. Hold and release pressure. Once you address both foot, then I finish with a solar plexus hold, and I got my essential oil. You just need a little bit because it's concentrate. I like to dilute with oil. And then find your solar plexus. So the solar plexus is if when we see the big toe here, and we have also the joint of the big toe. If you move into the second and the third toe coming down, is the solar plexus reflex. So I'm gonna hold on that in both foot. Inhale, exhale, and nicely just press gentle on both for about 60 seconds. And when you're ready, open your eye. I'm gonna clean a little bit the excess of the oil and demonstrate to you how I work on my jaw. So find your basilar's muscle. Okay, find the jaw joints. So whatever work better for you, I'm gonna use these three fingers here and then slowly open and close and go up and down. I press and hold and then small circles, open and close. Side to start losing some of the jaw muscles with a small pressure on the jaw joint. You can work the upper jaw first, open and close, and then do the same with the lower jaw. You can also put some resistance under your chin, open and close, and work from the center of your chin all the way on the outside of your jaw to where attached that can be very sore. So press, gentle, hold, and climb up. Do that again. Hold, press down, open and close, and eventually you will feel the release. This is what I have for today. I hope you find this helpful. If you have any question, please you can put it in your comments. Have a great weekend. Enjoy this beautiful date, and I will see you next week. Thank you so much.